Thank you, Madam President. Madam President, ladies and gentlemen of the Senate. Senate File 484 will create a safe, legal, affordable, and effective, and highly regulated way for Iowans and their families to access medicines made from cannabis. Sick and suffering Iowans are asking for our help. They are asking because Washington, D.C. is broken. The simple truth is that Iowa's elected leaders are the only people who can help them and their families. For many of these Iowans, their lives are really in our hands. Let's start by listening to two of these Iowans in desperate need. Kim Novi is from Altoona. She also happens to be with us this morning. Good morning, Kim. She is the mother of two daughters, Lauren and Lindsay, with intractable epilepsy. Last year, the Iowa Senate cast an overwhelmingly bipartisan vote in favor of helping families like Kim's. That legislation became law, but it didn't work. Listen to Kim's words about this. Unfortunately, obtaining the medicine in other states with medical cannabis programs is not possible without a medical card issued by that state. In addition, having two children in need of this medication, the out-of-pocket costs of traveling out of state for days at a time, added cost of the medicine, is not feasible for our family, end quote. Kim's daughters still need our help today, and I hope the Senate will vote to provide it. As I've worked on this issue, I've met many Iowans living with diseases and chronic conditions arbitrarily left out of last year's legislation. When you learn about the struggles each of these families face every day, it's hard to know how to respond. However, when you learn that medicine made from cannabis can ease some of the worst symptoms they live with, most Iowans, in fact 87% in the most recent poll, are ready to help. Katie Krug from Grimes is a 32-year-old wife and mother of two. She has ulcerative colitis, a chronic condition in which the lining of your colon becomes inflamed and develops ulcers. Listen to Katie's words, quote, "I have failed every medication out there, and I'm on my last possible medication before having my colon removed. All these medications are strong, with serious side effects, and my current medication can cause a brain infection leading to death. Medical cannabis has no such side effects. Of the 23 states that have approved cannabis for medical use, all approve ulcerative colitis and Crohn's disease." End quote. Today we can help Katie and other Iowans with devastating conditions. We can vote to give them the same safe, legal, affordable access to helpful medicines that most other Americans currently have. Here's how Senate File 484 will accomplish this goal. The legislation brings together the best practices of states that operate and manage successful medical cannabis programs. I've talked to legislators, public health officials, and advocates in the leading states. Iowa does not and should not reinvent the wheel. Based on the experience of other states and the success of treatments using medicines made from cannabis, Senate File 484 covers a number of debilitating conditions and diseases. These are the ones that are covered: cancer, multiple sclerosis, epilepsy, HIV/AIDS, glaucoma, hepatitis C, Crohn's disease or ulcerative colitis, amyotrophic lateral sclerosis, also known as ALS, Ehlers-Danlos syndrome, and post-traumatic stress disorder, and finally, severe chronic pain caused by an underlying medical condition that is not responsive to conventional treatments, or conventional treatments produces debilitating side effects. Compared to the current prescription drug system, this legislation creates a much more stringent system for legal purchases, possession, and use of medicines made from cannabis. For example, Today, to get a prescription drug, you simply get a prescription from your doctor, go to a pharmacy, and purchase it. In contrast, under Iowa's medical cannabis system, proposed in this legislation, a medicine is much more tightly controlled. To begin with, a medical practitioner must certify each year that you have one of those debilitating conditions that I've just named. That decision is then reviewed each year by the medical director of the Iowa Medical Cannabis Program, who is a state employee working at the Department of Public Health. Everything must check out before you are issued a medical cannabis card. The health department will take recommendations from a medical advisory board, and the board will make suggestions on the form and quantity of the medicine available to Iowans, and it will in the future review petitions from patients for the addition or deletion of diseases in the future. The Iowa Department of Public Health will license 4 facilities to grow the medicine and 12 geographically dispersed dispensaries where medicines can be purchased. This legislation includes a 9-point system of safeguards. These safeguards, based on the best practices from across the country, will ensure safe, legal medicine gets to the patients that need it and not people that don't. Number 1, a patient must be certified annually by a doctor as having a qualified disease or condition. Number 2, once certified, a patient can apply for approval from the Iowa Department of Public Health for a medical cannabis card. This approval is reviewed every year, in part to eliminate doctor shopping. Number 3, the Iowa Department of Transportation issues the medical cannabis card, allowing law enforcement 24/7 access to the database to ensure compliance with the law. Number 4, dispensaries must require of patients or their caregivers to show their medical cannabis card and ID when obtaining medicine. Number 5, detailed adult labeling and packaging is required for medicine. Number 6, all medicines made from cannabis in Iowa must be tested for quality and contamination by the state hygienic laboratory. Number 7, the Iowa Department of Health will establish a real-time tracking database between dispensaries to monitor and regulate the sale of the medicine. Number 8, licensees must follow strict security and tracking procedures at the production and dispensing facilities, and the Iowa Department of Public Health can inspect these facilities at any time. And finally, the smoking of this medicine is strictly prohibited. If this 9-point system of safeguards seems overly harsh or unmanageable, it isn't that different from regulations in place for other prescription drugs. The key difference is the fact that the state of Iowa will approve certifications on an annual basis and more closely track the purchase of medicines by individuals. I want to talk a little bit about cannabis as medicine, because it's a concern we hear from people. Is medical cannabis effective in treating specific disease and chronic conditions? Yes, it is. Cannabis has been more widely tested over a longer period of time than many other medications. There have been dozens of science-based clinical trials on the effectiveness of cannabis to treat specific diseases and chronic conditions. I have a summary here. I'd be happy to share it, and I have PDFs. I didn't print them all out, but I have in here about 35 different clinical trials that show effectiveness for cannabis across a whole variety of conditions. But don't take it from me. Take it from the University of Iowa College of Pharmacy. In 2010, the college was asked by the Iowa Board of Pharmacy to review all the science and studies available at that time. In 2010, the college was asked by the Board of Pharmacy to do this, and the Board of Pharmacy wanted to know if, in the expert opinion of the UI College of Pharmacy, there was clear evidence to support the use of medical cannabis in Iowa. Dr. Ron Herman from the College of Pharmacy led the review, and he concluded that indeed medical cannabis is effective in treating diseases and chronic conditions. The Pharmacy Board voted unanimously at that time in 2010 to recommend rescheduling from Schedule 1 to Schedule 2. So our best in-state source of advice on medical issues said, yes, medicines made from cannabis can be useful in treating disease, and there are Iowans currently receiving treatment at the University of Iowa hospitals and clinics that are participating in a clinical trial to see if cannabis can help. Almost exactly 1 year ago, the overwhelming majority of members of this chamber voted to allow epilepsy patients access to this medicine. That was the year that the Iowa legislature in 10 additional states approved cannabidiol oil as medicine to treat patients with intractable epilepsy. Iowans want the same access to other medications made by cannabis, the sort of access that more than half of Americans living in these 23 states and the District of Columbia already had. And that number is rapidly increasing. This year, at least 17 additional states are considering legislation to provide safe legal access to medicines made from cannabis. The bill before us is the product of a number of members that have worked on this issue over the last couple of years, and I want to thank all of those senators, Senator Snyder and Breitbach, and Senator Zahn, Senator Courtney, Senator McCoy, Senator Sodders, Senator Dotzler, Senator Peterson, and Senator Gronstal. You have helped craft this legislation, especially those who have listened, asked questions, and met the Iowans who would be helped directly by it. I would like to again thank the Iowa patients that have reached out to legislators time and time again to help us understand this complicated issues. Some of those folks are with us today, and thanks for making the effort. Thanks for living with more stress than any of us can imagine, and yet also take the time to speak to Senate committees, to talk to reporters, and to invite television cameras into your lives. Why would anyone in a medical crisis do that? They do it to get our attention, to get the people in this chamber to pay attention, to get us to listen, to convince the Iowa Senate to give them access to medicines that can help. Listen to John Custis's words. People like John Custis of Anamosa, a Vietnam combat veteran suffering with PTSD. John has been here at the Capitol several times. When I came home from Vietnam, life was not the same. I worked 4 years at the Anamosa Police Department and 20 years at the Iowa Men's Reformatory State Prison in Anamosa. The alcohol I used to self-medicate and PTSD took a toll on my life. Finally, in 2007, I was at the point of either going to kill myself or others. So I went for help on the PTSD. They put me on some very serious, dangerous drugs. I weaned myself from those drugs because of the side effects. No matter how tired I am, there is never a night I look forward to going to bed because I never know what I will see in my sleep. I don't use marijuana. I'm not interested in getting high or stoned. I would like to see if cannabis can lessen my PTSD symptoms. Our job today is to help veterans like John Custis, Iowa moms like Katie Krug, and Iowa children like Kim Novi's daughters. We can do that by voting for this bill, Senate File 484, and creating a safe, legal, affordable, effective, highly regulated way for Iowans and their families to access medicines made from cannabis. Thank you, Madam President. Those are my opening comments. Happy to answer questions. There are amendments.